Okay, John, I believe you're still on the phone. You had another question for
Yeah, I
me?
have one further follow-up, and that is, I appreciate your time on this. I've been dealing with this situation for 6 years, at least, when feeling the symptoms and the erosive gastritis, and my weight's slowly improving. It's slowly getting better, but I've been dealing with this for 6 years. Is this ever going to, the proton pump inhibitors, when I do take them for 3 or 4 months and I stop for a month or 2 months, they do make the stomach feel better, more normalized. Is this going to heal on its own, or is this something I'm going to have to deal with going forward?
Well, you know, I guess I'm not your gastroenterologist, so it's really difficult for me to say. But I would say, since you've been dealing with it for 6 years and haven't found a cause for it, such as increased gastrin level or any one of those other issues, then I would probably say yes, you're probably going to be dealing with this for the rest of your life, which is an unfortunality. And I don't know that any diet is going to change it. But then again, there are a lot of people that dwell in homeopathics and things of that nature. So, you might want to I would encourage you to look at some other things that might be able to help you. You have to be very clear. There's a lot of predators out there wanting to sell you food additives that can make a lot of claims that do nothing. So do your research extremely well before you give up one treatment for the other. And I would say stick with the proton pump inhibitors. Even if you did a 2-day on, 2-day off routine, that would give your body a break rather than going off for a month and then developing your symptoms again. So, and the other product that you could use in place of the proton pump inhibitor would be medication like Zantac or Pepcid. They're basically an antihistamine, a weak acid secretor. So, inhibitor meaning. So what happens with those particular drugs is they work on the histamine receptor different than allergies at H1 and H2, and it works on the one that's not involved in allergies. The benefit of Zantac is that sometimes you actually get relief with some of your allergies. The other thing is, considering the proton pump inhibitor that you're on, and I don't know which one you're taking, but Dexilant or one of those True 24 Hours can be helpful, as opposed to Prilosec, which is maybe 20 milligrams, and then they've gone up to 40 in some patients, but maybe 20 twice a day would be as effective as 40 a day on something else. So that being said, yes, you probably are going to suffer with it, but there may be a way that you can deal with it and give your body a break and get the benefits of the treatment without the harmful side effects. So
Proton pump, you say maybe take them for 2 days on, 3 days on, a couple days off?
yeah, I mean that would be the equivalent to going basically 1 month. I mean, doing it in 4 or 5 months and then taking a month off. Basically, if you're doing it for 2 or 3 days and then giving yourself a drug holiday for 2 or 3 days, it would be the same, close to the same equivalent process. And then that way you could remain on them for a longer period of time and not go off of them and let your symptoms develop and then have to heal your stomach again and go off of them, heal your stomach again and go off. So an alternating regimen might give you the same benefit of what you're trying to do without having to make yourself uncomfortable for the months that you're off.
And you say also try the H2 blockers?
Yeah, while you're basically taking, to give yourself some protection when you're off of the proton pump inhibitor, you could take a Zantac, you get your doctor to prescribe you Zantac 150 or even 300 and take that, and that's going to slow the acid down. Not as much as a proton pump inhibitor, but it doesn't have all the harmful, it's just not as strong, so therefore you're still going to get some protection, but you're not going to develop the gastritis that you might develop after being off of it for a month.
How about just taking the H2, try those instead of the proton pump and see what happens?
Well, the proton pumps are much stronger than the H2 inhibitors. They're basically because of what they are. They really control acid to a much greater degree, and they were developed. The proton pumps inhibitor Zantac was developed in the 70s and 80s. It's still effective today. I tell some patients that really have a lot of problems with hiatal hernia, and they don't want to take more proton pump inhibitors, that they sometimes can take the Zantac at the night and the proton pump in the morning. In your case, if you're looking for a break, it would be 2 or 3 days of the proton pump inhibitors and then the Zantac.
Sounds good.
I hope that helps you. And again, I would encourage you to discuss that with your gastroenterologist who's following you when you're going in for your checks. And I would encourage you, again, to keep up with the scopes, because if you have that type of problem, you want to try and develop and catch any abnormal cells that might develop and turn into cancer for you. So.
Okay.
And
Thank you
again,
very much, Doctor.
you're quite welcome, John. Thank you for calling in.
Bye-bye.
Yep. And again, at the bottom of the screen, I think you'll see the number for that lupus support group. If you have lupus or know somebody that does in the area, please make note of that number. Okay, so very good question and very good topic for discussion on the gastritis and hiatal hernias and GERD. One of the things I tell my patient, if you have a lot of GERD or reflux, is to take two 2x4s and put them under the head of your bed. Or under the foot post of the bed. I mean, 2x4 blocks. It doesn't have to be the whole board, but you're elevating your head of your bed 4 inches, and in doing that, you're able to keep a lot of the gastric contents down in your stomach, preventing them from refluxing up into your throat. And if you didn't know it, and I know I've said it on this phone, GERD, or chronic gastroesophageal reflux, is another cause for COPD, not just smoking, but chronic obstructive pulmonary disease because of chronic irritation. Now, if you're one of these people that has this chronic cough at night, or at night, it could be all during the day, and you're not on a lisinopril or one of those ACE inhibitors, you might have gastroesophageal reflux disease. It is the cause of a lot of chronic coughing because of the chronic irritation that the gastric acid produces when it's bellowing up into your esophagus. So there's an anatomic defect that develops, and I probably, if I don't have a picture of it, I'll talk about it next time. As the chest wall weakens and the diaphragm weakens, the stomach is pushed up into the chest, and the chest is a vacuum. It's kept open by the force of water, meaning electromagnetic condition. The lung is one of these very interesting organs in that there's just a thin layer of water between the two membranes in the lung that holds it open. And if you don't realize how important that force is, all you have to do is remember what happens when you take a glass of water and you put it on ice water on a tabletop of glass, and it condenses. It's very difficult for you to pick up the glass. You have to slide it off. Well, that same force between water molecules is what's keeping your lung open. And when you puncture the chest and you separate that as you slide it off, the chest collapses. And that's why you have to put a chest tube in you to open back up your lungs. So that negative pressure pulling on your stomach up into that into the chest is pulling the pyloric sphincter open, allowing acid to come up into your esophagus. And Louis mentioned earlier about chest pain. One of them, and you can't tell the difference, and I want to make this very clear. You cannot tell the difference between esophageal pain, spasm in your esophagus, and a heart attack. The pain is identical. It can radiate to your left chest, your left arm, it can radiate to your back and your neck, because it's the nerves in the area that you're feeling. So esophageal reflux, and that's one of the common, I don't want to say sad, but misdiagnosis is sometimes that people will have a lot of reflux and a lot of acid in their stomach, and they eventually, they'd say, oh, it's just your stomach, and then you go home and you have a heart attack. So nobody can tell the difference between the two. So esophageal reflux pain is heart attack pain until proven otherwise. And with that being said, as we get older and our bellies get bigger and weaker and the diaphragm gets weaker, we're more susceptible to reflux disease. And if we eat a lot, we'll bellow those things up there. So if you have it, elevate the head of your bed. It's a very simple technique. You could use any one of the medications over the counter, but also make sure you see your doctor. So We're almost going to be running a little bit low on time. We have about maybe 3 minutes left in the show. Let's bring up one last slide, I think, on the diverticular disease. This is actually a copy of a CT scan. And in this particular patient, you can see the numerous diverticulosis, or the diverticuli that this patient has, and all those little bitty circles of black in an X-ray are air, and you can see they're actually on the edges of the colon, and it looks like somebody just peppered it with basically a shotgun, but those are actually outpocketings of the colonic wall. And that is a pretty severe case of diverticuli. Now, just because you have diverticuli, we need to get our terms down. Diverticuli are the actual holes that you see there. Diverticulosis is when they become irritated and they bleed, and diverticulitis is when they become plugged and they become infected. So again, diverticuli is what you see on the screen. Diverticulosis is when they bleed or become irritated, and diverticulitis is when they become infected. If you happen to have that condition, it's very important to remember that that's why doctors like myself and other people will tell you, if you have this condition, to stay away from nuts and seeds and things that are not digested well, because they can get into those holes, and if they plug up that hole, the bacteria from the E. coli and all the other substances can't be flushed out, and an abscess can develop. And I've seen some pretty severe ones in my time where people have to have them removed and have to have abdominal surgery. So I hope you enjoyed tonight's show. I might be on vacation next week. If so, there will be a rerun. But we'll tune in next time, and thank you for being here.